Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been noticing a bit of irritation in my throat lately. It happens sometimes when I'm singing in the church choir, and it's starting to make my voice hoarse. There's no pain really, just a scratchy feeling that won't go away easily. I've been coughing a bit more during the day, too. I thought maybe it was the dry air or something to do with my old dust allergies, since I used to get this feeling back when I smoked or cleaned the attic.
It's good that you've observed these specifics about when the irritation occurs. Do you feel like the symptoms have worsened recently, or have they been fairly consistent over time?
It's definitely more recent. The cough isn't bad, but the throat issue comes and goes. It's annoying, especially when I want to be active in the choir.
Understood. And what about any other symptoms? I recall you mentioning something about your feet.
Yes, about 2 months ago, I started feeling this tingling sensation in my feet. It's like pins and needles. Sometimes it goes up my legs a bit. It's pretty constant. I know I've had diabetes for a long time, and I'm worried this might be related to that.
That's a valid concern, especially given the duration of your diabetes. Have you noticed any changes in the sensation or strength in your feet and legs, aside from the tingling?
Not really, just the tingling. No weakness or pain, thankfully. It's more annoying than anything else, but it's got me worried.
I see. How have you been managing your diabetes recently? Any changes in your diet, exercise, or medication?
I've been sticking to my routine pretty well. I take my insulin daily, and I've been keeping up with my stationary bike exercises. I haven't changed much lately, just keeping things steady.
Great to hear you're maintaining your exercise routine. How about your blood pressure and any other medications? Any issues there?
No issues that I've noticed. I've been taking my meds as prescribed. I do get a bit nervous with clinic visits, so it spikes sometimes here, but at home it's much lower.
That's quite common with white coat syndrome. We'll consider your home readings as more reflective of your usual blood pressure. Let's also make sure we keep an eye on how your throat symptoms and the tingling in your feet progress. Now let's review some of your recent health metrics and tests to get a clearer picture. Your recent fasting blood glucose levels have been around 132 milligrams per milliliter, which is fairly controlled, but we'll keep monitoring it. Your blood pressure today is high here at 150/90 mmHg, but as we discussed, your home readings are much lower, which is reassuring. Your pulse is low at 41 BPM, which is typical for you, and there are no respiratory concerns today with your breathing rate at 16 per minute.
That sounds about right, Doctor. Do you think these issues with my throat and feet could get serious?
For your throat, it seems like it could be related to your allergies or perhaps some irritation from environmental factors. As for your feet, the tingling is likely an early sign of diabetic neuropathy. Since your diabetes has been long-standing, it's something we need to keep a close eye on.
What do you think we should do next then?
For your throat, we can try a nasal spray and possibly an oral antihistamine to manage your allergy symptoms. I'd also recommend that you try to keep the air in your home moist, especially when the air is dry. For your feet, continuing with good diabetes management is crucial. We'll focus on maintaining your blood glucose levels. I'd like to schedule a follow-up in 3 months to reevaluate your symptoms and adjust our approach as needed.
That sounds like a plan. Thank you, doctor. I appreciate your help.
You're welcome. It's important to manage these symptoms early on. We'll see how things go and adjust if needed. See you in 3 months for your follow-up, and don't hesitate to call if anything changes or worsens.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been managing with the insulin shots you recommended, but I'm still concerned about my blood sugar levels. They hover around the 130s to 140s, which I know is a bit high. I've been avoiding insulin aspart since that incident with severe hypoglycemia last year. That was really scary for me.
I understand your concerns about hypoglycemia. It can be very alarming. How have you been managing your diabetes since stopping the insulin aspart?
Well, I've been using insulin glargine every morning, but it's tough to balance sometimes, especially when my routine changes. I'm not always sure if I'm doing the right thing, especially since I stopped the metformin. I'm also confused about why I received so many syringes all of a sudden.
It sounds like there's been a bit of confusion with your medications and supplies. We'll definitely look into that. Have there been any other changes in your health or new symptoms that you've noticed?
Actually, yes. My podiatrist prescribed me an antifungal cream and an iodine solution for my toes, which have been bothering me. And there's this non-healing skin condition on my calf. It doesn't hurt, but it's not going away, despite using the creams.
I see. It's good that you're treating your feet, and we'll address your calf as well today. You also mentioned poor circulation in your left leg.
Yes, that's right. I often feel a kind of heaviness and coolness in that leg compared to the right one. It's been this way for a while now.
Thank you for sharing that. It helps complete the picture. How about your diet and exercise? Managing those is key in diabetes.
I try to stay active, but it's hard with my leg issues. As for my diet, I think I'm doing okay, but maybe I could use more guidance there.
We can arrange for you to see a dietitian again to optimize your dietary management. Now I'd like to go over some recent test results with you. Your hemoglobin A1C is at 7.2%. which indicates that your average blood sugar has been slightly high. This aligns with the blood sugar levels you've reported.
I was hoping those numbers would be better. What about my kidney and liver functions?
Your kidney function shows a mild decrease with an eGFR of 58 millispam and 3 Guar. which is something we'll monitor closely, but it's stable. Your liver tests are within normal limits, which is good. Your cholesterol levels are also fairly controlled, but we could aim for some improvement there.
What are our next steps then? I feel like I need some changes or maybe additional help managing everything.
Based on our discussion and your results, I believe reintroducing metformin could be beneficial for better sugar control without the risk of hypoglycemia. It's generally well tolerated and could help with your insulin sensitivity. We'll also need to keep an eye on your kidney function while on it. I'll prescribe triamcinolone ointment for the skin on your calf to see if that improves healing.
Do you think that will help with my leg circulation too?
For the circulation issues, continuing to manage your diabetes effectively is crucial, and we might consider compression stockings to help with the venous insufficiency. The Doppler study did show some mild abnormalities. Also, an appointment with a vascular specialist might be beneficial if things don't improve.
Okay, that sounds comprehensive. What about the syringes and my insulin supply?
I'll ensure you have a prescription refilled for your insulin and test strips. About the syringes, it seems there was an error in the order. We'll correct that to make sure you receive what you need without excess.
That's a relief. Thanks for helping me sort this out.
Of course. I'd also like you to schedule a follow-up appointment in 6 months, but if you have any concerns before then, don't hesitate to contact us. Additionally, it's important to keep up with regular eye exams, especially with your diabetes. I noticed it's been a while since your last check.
I'll make sure to schedule that. Thank you, doctor. I appreciate your help in managing all these details.
You're welcome. Remember, managing diabetes is a team effort, and we're here to support you. I'll see you in 6 months, if not sooner, and we'll check on all these points again.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've noticed your wound isn't healing as expected. Have there been any changes in your environment that might be affecting it?
Well, I recently started a gardening project at home. I'm not always wearing gloves, and it's quite dusty and dirty.
That's likely contributing to the issue. Soil and organic material can introduce bacteria that may infect the wound. It's crucial to keep it clean and covered, especially in such environments.
I didn't realize that could be a problem. What should I do to protect it?
Always wear gloves while gardening and clean the wound thoroughly with soap and water afterward. Also, apply a sterile dressing to shield it from dirt and debris. If you notice any signs of infection like redness or increased pain, let me know immediately.
I will definitely follow those guidelines. Thanks for the advice, doctor.
You're welcome. Let's monitor the wound closely. I'll schedule a follow-up appointment to ensure it's healing properly.
Now look at question 26.
Today, I'm excited to introduce some groundbreaking digital health tools that are transforming patient care. First, we have a smart wearable that continuously monitors heart rate and blood sugar levels, sending real-time alerts to both patients and their healthcare providers. Next, there's an app that helps manage chronic conditions by allowing patients to track symptoms, medication adherence, and receive personalized advice directly from their healthcare team. Lastly, we've developed a virtual reality system for pain management. It immerses patients in calming environments, which has been shown to significantly reduce pain without the need for medications. These tools not only enhance patient autonomy, but also improve the accuracy and efficiency of healthcare delivery. Any questions on how these can be integrated into your practices?
Now look at question 27.
There have been some proposed changes in our healthcare policies that might affect your treatment plan. One major change is the introduction of a new billing system designed to reduce out-of-pocket costs for patients.
That sounds promising, but how will it affect my current treatments and medication?
It's designed to be beneficial by making healthcare more affordable. For example, some of the medications you are currently on might become cheaper, or you might be eligible for additional support services.
Will there be any disruptions to my care during this transition?
We're doing everything possible to ensure a smooth transition. You might notice some changes in billing or how you schedule appointments, but your care continuity will be our top priority.
Now look at question 28.
Welcome to today's session on travel health consultation. Our focus is to prepare you medically for international travel, ensuring you stay healthy and safe abroad. We'll discuss necessary vaccinations depending on your destination and provide tips on managing health conditions in different climates and environments. It's also important to be aware of potential health risks like food and water safety, insect bites, and local diseases. We'll equip you with preventive measures and what to do in case of a medical emergency while traveling. Finally, we'll review your current health status to tailor specific advice and precautions. This consultation aims to ensure that your travel is not just enjoyable, but also safe.
Now look at question 29.
I see you've been experiencing migraines frequently. Let's discuss some treatment options that could help manage your symptoms.
I've tried over-the-counter pain relievers, but they're not very effective. What else can you recommend?
You might consider prescription medications like triptans, which are specifically designed to treat migraines. There are also preventive medications if your migraines are frequent and severe.
Are there any side effects I should be aware of?
Like all medications, these can have side effects, including nausea and dizziness. It's important to start with the lowest effective dose and see how your body responds.
Thank you for the information. I'll consult my doctor and see if we can start with triptans.
Now look at question 30.
Today, we address the vital topic of Indigenous health in our hospital system. Our goal is to enhance culturally competent care and improve health outcomes for Indigenous communities. We're introducing training programs for our staff on cultural sensitivity and awareness, ensuring that care practices are respectful and informed by Indigenous health perspectives. Additionally, we're collaborating with Indigenous health leaders to integrate traditional healing practices with conventional medical treatments, offering a holistic approach to healthcare. These initiatives are just the beginning. We are committed to continuous dialogue and improvement in our services to better meet the needs of Indigenous patients.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Welcome, everyone. I am Dr. Emily Thompson, a medical oncologist with a focus on breast cancer research. Today, I will discuss the groundbreaking results from the DESTINY-Breast04 trial, which evaluated the efficacy of trastuzumab deruxtecan in HER2-low metastatic breast cancer. We will also explore a relevant case study that illustrates the clinical implications of these findings. Firstly, let's define what we mean by HER2-low breast cancer. Historically, breast cancers have been categorized into HER2-positive and HER2-negative groups based on the presence of human epidermal growth factor receptor 2, HER2, which promotes the growth of cancer cells. In clinical practice, we quantify HER2 levels using immunohistochemistry IHC scores, with 0 and 1 plus traditionally classified as HER2-negative. However, emerging research, including the DESTINY-Breast04 study, identifies a subgroup within the HER2-negative category, HER2-low, which includes tumors scored as IHC 1+ or 2+ without gene amplification. The significance of identifying and targeting this subgroup has become apparent with the advent of antibody-drug conjugates, ADCs, specifically trastuzumab deruxtecan. This ADC combines the HER2 targeting capabilities of trastuzumab with a potent chemotherapy drug, allowing precise delivery of chemotherapy to HER2-expressing cells, thus minimizing systemic exposure and enhancing tumor cell kill. In the DESTINY-Breast04 trial, a Phase 3 study, patients with HER2-low metastatic breast cancer who had previously undergone 1 or 2 lines of chemotherapy were enrolled. These patients were randomized to receive either trastuzumab deruxtecan or the physician's choice of several standard chemotherapies. The primary endpoint was progression-free survival, particularly in the hormone receptor-positive, HER2-low cohort. The results were quite promising. The trial demonstrated a 50% reduction in the risk of disease progression in the hormone receptor-positive group treated with trastuzumab deruxtecan compared to those who received standard chemotherapy. Overall survival also improved significantly, showing a 35% reduction in the risk of death. These outcomes underscore the potential of trastuzumab deruxtecan as a game-changer in treating this subset of breast cancer patients. Let's discuss a case that highlights the clinical relevance of these findings. Consider the case of Jane Doe, a 55-year-old woman with hormone receptor-positive HER2-low metastatic breast cancer. Jane initially presented with localized breast cancer and underwent lumpectomy and adjuvant chemotherapy. 2 years later, she developed bone and liver metastases. Her tumor was retested, revealing an HER2 score of 1+ by IHC, classifying her cancer as HER2-low. Based on the DESTINY-Breast04 results, Jane was started on trastuzumab deruxtecan. Within 6 months, her scans showed a significant reduction in liver metastases and stabilization of bone lesions, translating into improved quality of life and reduced pain. This case exemplifies the potential impact of this new therapeutic option for patients like Jane, who previously had limited targeted treatment options. However, while the efficacy of trastuzumab deruxtecan is compelling, it is crucial to discuss the safety profile and management of side effects. The most common adverse effects observed in the trial included nausea, fatigue, and neutropenia. Importantly, lung toxicity emerged as a serious side effect, albeit in a small number of patients. It underscores the need for vigilant monitoring and early intervention to mitigate these risks. The findings from the DESTINY-Breast04 trial represent a significant advancement in the treatment of HER2-low metastatic breast cancer. It's a step towards more personalized therapy, where even low expression of a target can be effectively exploited to improve patient outcomes. As we anticipate further studies to refine and expand the use of trastuzumab deruxtecan, it's imperative that we as clinicians are prepared to integrate these new therapies into practice, ensuring that our patients receive the most effective and safe treatments available.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Thank you for joining me today to discuss a rather contentious issue in critical care and neurology, whether informed consent should be necessary before conducting apnea testing to determine brain death. As we know, this has sparked a considerable debate across medical and legal fields.
Absolutely, and it's a pleasure to be here to delve into this complex topic. The heart of the issue seems to lie in the balance between medical necessity and ethical obligation, particularly when it comes to a procedure that could conclusively determine death by neurological criteria.
Right. To ground our discussion, let's consider a recent case study that illustrates these challenges. We have a 28-year-old patient who suffered a severe traumatic brain injury following a motor vehicle accident. Despite aggressive management in the ICU, the patient's neurological responses deteriorated, leading to the consideration of brain death testing.
This case really brings to the forefront the ethical dilemma. Typically, apnea testing involves temporarily ceasing mechanical ventilation to observe if the patient attempts to breathe independently, signaling some brainstem activity. Here, the ethical question is whether we should proceed with this test without explicit consent from the patient's family, given its risks and the irreversible declaration of death that follows a negative test result.
Exactly, and it's worth noting from Harvard scholarly articles that while apnea testing is a standard diagnostic procedure, its potential to cause harm, such as exacerbation of brain injury or even cardiopulmonary instability, requires us to tread carefully. The question then becomes, do we view this testing as a routine assessment of vital functions, akin to checking a pulse, or as an invasive procedure that warrants explicit informed consent?
Harvard's ethics scholars argue that the nature of apnea testing, being both diagnostic and consequential, demands a higher standard of consent. The underlying assumption is that patients are alive until proven otherwise, and thus, subjecting them to a test that could confirm death transitions into a realm where family members should have a say, especially when the outcomes influence decisions about organ donation or terminating life support.
That's a crucial point. In our case study, the patient's family was initially hesitant. They needed time to process the situation and understand the implications of the test. This hesitancy highlights another dimension, cultural and individual variability in perceptions of death and dying, which Harvard researchers emphasize should be considered in the consent process.
Certainly, and this aligns with recommendations that advocate for clear communication and education of both healthcare providers and families regarding what brain death entails and what apnea testing involves. The goal is to ensure that consent, when sought, is truly informed.
In light of this, perhaps the future of this practice could see a more standardized approach to obtaining consent that respects both the medical imperatives and the diverse ethical, cultural, and personal values of patients and their families. Maybe incorporating advanced directives that address potential scenarios involving brain death could be a step forward.
Absolutely. Integrating advanced care planning and directives is pivotal. As medical technology advances and prolongs life in ways previously unimagined, our ethical frameworks and legal standards must adapt to ensure they adequately reflect contemporary societal values and medical realities.
Furthermore, the issue of patient autonomy in critical care settings, especially when the patient is incapacitated, becomes a significant aspect of this debate. How do we balance this autonomy with medical judgment when the patient cannot speak for themselves?
That's a critical question. It calls for a multidisciplinary approach involving ethicists, legal experts, clinicians, and patient advocates to develop guidelines that are both ethically sound and clinically practical. Engaging these stakeholders in discussions about policy changes and practice guidelines can help shape a consensus-driven approach to these challenging scenarios.
Indeed, such discussions are essential. Another aspect to consider is the potential emotional impact on healthcare providers who are tasked with conducting these tests and possibly facing ethical dilemmas in real time. Supporting our healthcare professionals with adequate training in ethics and communication is just as crucial.
I agree. Providing support systems and training for healthcare providers will not only help them make more informed decisions, but also cope with the emotional burden that these complex cases often carry. It's about creating an environment where ethical practices are the norm and where difficult decisions are supported by a robust framework.
Well, it's clear that while the debate around informed consent for apnea testing is far from resolved, discussions like ours help in navigating these murky waters. Thank you for such an insightful exchange on this pressing issue.
Thank you as well. It's through these discussions that we can hope to find a balance that honors both the science of medicine and the dignity of the patients we serve.